which drug is good for controlling PCOS? And let's look at this COMET PCOS trial. And what we're looking at the effects of PCOS on the cardiovascular risk factors, especially with PCOS and obesity. And they used two of the commonest medications in a double-blinded randomized controlled trial in 2 US sites. And it involved about 240 women with hyperandrogenic PCOS and a BMI of more than 25. And they were selected randomly and assigned to one of the 3 treatment groups. And that was carried out for 6 months. So what was the first group? Giving oral contraceptive pills, 79. Number 2, Metformin, 81. And number 3, a combination of OC pills and metformin. Now, for a long-term assessment, both these drugs have been used for a long time. So what was the primary outcome? And the primary outcome was the metabolic syndrome, which eventually happens with PCOS, and its prevalence. And it seems that there was no difference in metabolic syndrome prevalence between 3 groups after 24 weeks. 27% OCP group, 26% metformin, and a combined 27%. So if you see the benefits of the OCP group, it decreased waist circumference, it increased triglycerides and fasting glucose. The metformin decreased waist circumference and blood pressure, and the combined group improved HDL levels. Between all the 3 groups, only blood pressure showed a significant difference between the OC pill and metformin, where blood pressure may rise giving OC pills. Now, why is this important? One is, while you're trying for pregnancy, it's different. If you're not trying for a pregnancy, you want to look after symptoms. So what is its benefit long term? And the option then tends to be OC pill or metformin. And the choice between that doesn't seem to hugely affect the overall metabolic syndrome in PCOS with obesity. So if you look at an individualized outlook, while the overall risk of the metabolic syndrome, and that's important, metformin was not reducing the metabolic syndromes, were not hugely affected, this gives us a general idea into looking at the risk factors and trying to look at the cardiovascular risks and helping to manage the study. So this study, to a certain extent, tells us the complexities of PCOS, the risk of on the heart, and also the mixed risks with different protocols. And this, to a large extent, helps us to understand that while you can try using both will have their benefits or the combination, but also remember that there are complications with the pill, and the effect of metformin is also limited. It also tells us that if you gave the pill, the oral contraceptive pill, it does not seem to worsen polycystic ovaries and its metabolic syndrome.